Hospice and Palliative Care Month. Palliative care, if you haven't had the need to know this yet, consider yourself lucky, but it is specialized medical care for people living with serious illnesses, and some very special people work in this field. To explain palliative care and hospice care, we're going to welcome Dr. Sonia Malhotra from East Jefferson General Hospital, and also Cinnamon Tucker, a palliative medicine nurse practitioner. Thanks for being here, guys.
Thank you for having us.
Absolutely. So explain to people what it is that you do on a daily basis and the difference between the two.
Sure, that's a great question. A lot of times people don't really understand that there is a separation. They think palliative, it means hospice, that means end of life. Palliative is so much more than that. Palliative means for people who are facing a life-limiting illness or a trauma, like what we see every day here in New Orleans, it's how to help someone live as well as possible for as long as possible, but also to have those really serious conversations when an illness or an injury are incompatible with life.
Wow, the way you say incompatible with life, I mean, you are coordinating their entire quality of life once they meet you. Talk about what that partnership looks like with outside agencies as well.
Sure. First, it's listening to the patient and family, making sure they understand exactly what's happening. Because you see a bunch of monitors and beeps and people coming in and out, and they really don't understand what's exactly happening. So our job, and it's a privilege and an honor, our job is to walk that family, that patient through every single part of that illness. There's only one time to die. And all of the circumstances around that should be as smooth as possible. So our job can be really fast, and that, especially if it's a trauma or if there's a burn emergency, sometimes it goes really fast, and then sometimes it's a little bit slower with chronic illnesses like cancer, heart disease, lung disease, liver disease, or patients waiting for a transplant. I'm
going to ask both of you this question, but Cinnamon, if you can start off with the really important conversations that you need to have with your family while you're healthy so that the hospice process is as peaceful as possible.
Absolutely. I always tell people, a lot of people have that little red heart on their driver's license, but their families never ever know. And so while you're well, while you're healthy, while you're strong, I always take this time. I'm so glad that November is Hospice and Palliative Month, because at Thanksgiving dinner, we need to have these conversations with our loved ones, not just the ones that are older, but all of our family members, so we know what to do.
Dr. Malhotra, what does that look like in the hospital setting, and how, when a patient meets you, what does it mean?
So palliative medicine is an interdisciplinary team. We have physicians, we have nurse practitioners, physician assistants, social workers, chaplains, pharmacists working within our team. And so when we meet a patient in the hospital setting, we employ the entire team to take care of that patient and meet them where their needs are at, meet the family where their needs are at, and ensure that they get that comfort of care and walk that journey with them and take care of their symptoms, anything affecting their quality of life, the communication around the serious illness, all of those aspects.
If you can tell a patient base that's watching now, last words here, what conversations do you want them to have with their families?
I definitely want patients who are living, and I said living, not dying necessarily, with serious illness, to ensure that their families know their wishes, that they filled out certain documents, a medical power of attorney, what their advance wishes are. Make sure to normalize that process of talking about illness, talking about death and dying, talking about what is acceptable to your body for your life.
How much of a difference have you seen it make in that moment, a family that has talked about it and one that hasn't? Leave us on that note.
Over 10 years of building palliative medicine in this region, I've seen that those families that are prepared, those patients that are prepared, and I think Cinnamon can agree, really those outcomes are better, and we are able to respect a person's wishes and their body as they near the end of life.
Dr. Sonia Malhotra and Cinnamon Tucker, thank you so much for being here.
Thank you
for having us.
Absolutely. All right, let's check in.